For the 6-week postpartum visit of the birthing person, the exam should include explaining the procedures to the client, providing education as indicated, doing a health assessment, answering any questions, if any procedures are done, obtaining consent, a full exam and or pap smear and or breast exam may be indicated, and those should be explained, and answering questions and obtaining consent for all. The supplies that are needed are standard physical exam supplies, so a blood pressure cuff, a scale, a thermometer, a reflex hammer, a light pen, an otoscope. For the exam, a blood draw may need to be done, so we'll need gloves and lab supplies. For the pap smear, we would also need the lab supplies for the pap, gloves, lubricant, speculum, Chuck's pad. Other supplies that we would need would be a stethoscope, alcohol wipes, a watch or a clock with a second hand. For the physical exam, take blood pressure, temp, pulse, standard vitals. Also weight. For the blood draw, it may be indicated to check the hemoglobin depending on blood loss or hemoglobin prior to birth. If they need a physical exam, this would include abdominal exam and breast exam, checking for reflexes and heart and lungs as indicated. For the abdominal exam, assess if they had a surgical birth, assess the incision for healing and or infection. It would also be appropriate for them to follow up with the provider that performed the exam, but sometimes the provider that performed the exam will transfer care back to the midwife. So in that instance, it does need to be addressed, and if anything unusual or if there are signs of infection, they need to be referred. During the abdominal exam, also check for uterine involution and any tenderness and diastasis recti. For the health assessment or education and counseling, discuss bleeding, lotia color, consistency amount, lactation. Even if they aren't lactating, you still need to address if they're having soreness or engorgement, their milk supply, the baby's feeding schedule. If they're having any other physical problems, it's important to address nutrition, sexuality, family planning, and activity level. It's also especially important to do an emotional well-being assessment for postpartum depression. During the pelvic exam, which may be indicated, it may not be, the client may desire to have one, provide education, answer questions, obtain consent, discuss what's being done during all parts of the exam, and always give the client permission to ask permission to stop or give any questions and feedback at any and all points. So during the pelvic exams, first visualize the perineum. Were there any lacerations? Was any repair done? Are there sutures healing? Is there anything else that is abnormal about the external genitalia? For the digital part of the exam, inspect the vagina and the cervix. Assess for cervical motion, tenderness, any cystoceles or rectoceles. During the exam, do it by manual of the uterus and the ovaries. Check for muscle tone by asking them to do a Kegel. A rectal exam may be indicated. It may not be. It may be desired if they have any hemorrhoids or discomfort, so check for those as indicated, and then remove and dispose gloves. If a pap smear is indicated, follow the procedure according to the lab and collecting the specimens. After the exam, explain all findings to client, answer any questions, giving any advice or referrals as indicated, create a plan and follow up if indicated, chart and document all the findings, any recommendations or referrals, answer any questions if they have any last questions about their birth or their infant, and refer the client or the infant to a different provider for pediatric care as indicated.